This is Walter Kemp. This is Aneurysms Part 3. This is Kootenai Falls. This is outside of Libby. There's a movie with Kevin Bacon, A River Wild. I've never seen as much water go over these falls as I did in that movie because they opened up the dam and stuff like that. But anyway, that's Kootenai Falls. A lot better than this one. Aneurysms Part 3. There are the websites that Dr. Hughes and I have for questions, my Twitter. And like I said, I'm a forensic pathologist, but I really have a strong interest in all types of pathology. And I think I learn on a basic level, and I really enjoy teaching medical students, and I hope you like the lectures. So I have disclaimers. If you would, pause, read them. Make sure that you shouldn't be watching the lecture. If you shouldn't be, then turn it off. If not, continue. Third disclaimer, and like I said, I really want to teach people pathology, but I want to make sure the people watching it are the ones who should be watching it. And then, like I said, if you want to know about my teaching style, it's in the introductory presentation. Here are my references. Sorry, on the last lecture I had this question, and then I forgot to do it at the end. I apologize. So I just put in here, and the answer is at the end, I promise. And then I have one more question that was already on here. So if you pause, look at it. Like I said, this kind of guides you as you go through the lecture, trying to think about things and stuff like that. It helps aid in retention. So we talked about with hypertension, we talked about aortic dissection, but the old term for aortic dissection was dissecting aneurysm, which it's not. It's not an aneurysm. If anything, it would create a false aneurysm if it ruptured and then if it got contained. So that term really isn't used. But one thing with medicine is even though there's new terms and stuff like that, you're still going to hear a lot of old terms. It's just the way it is. And so it's always useful to know that they were called dissecting aneurysms, so I include it here. So with the aortic dissection, obviously there's tearing in the wall of the aorta, so the good chance that and it goes into the media, the muscle. So there's got to be a good chance there's something wrong with the muscle. So cystic medial degeneration, which used to be called cystic medial necrosis, but it's not necrosis, is one. I've had patients with Marfan syndrome, and they had just, like I said, pools of that bluish material within the spaces. But you can see in people with hypertension, advanced age, and that. And then remember, with an aortic dissection, they're going to have sharp pain. It's tearing the aorta, which goes along with that, radiating to the back, but other areas as well. Pulse discrepancies, because if it dissects past the right subclavian pulse will be different than the left subclavian pulse that's being affected by the dissection. Wide mediastinum, because it widens that aorta, the hemorrhage within it potentially, and then can create a murmur, because if it dissects back, you can get an acute murmur aortic insufficiency. And then here's just two more showing it. So the top left, the white arrow shows the tear in the intima. So to get in the media, the blood has to go through the intima. Okay, it tears and then tracks along the media. And like the one I showed you in the hypertension lecture, it is possible for it to go intima, media, intima, in which case a person would survive that just fine. However, in my experience as a forensic pathologist, and of course I'm biased, but mine go intima, media, adventitia, and then rupture into the pleural cavity, pericardial sac, or potentially the peritoneal cavity. Although I don't know if I've ever seen that one. To the bottom right of it is microscopic. So the black star shows the lumen of the aorta, the red star shows the adventitia, and then the black arrow is the hemorrhage. And it's usually in the outer 2/3 of the media, right in that location. So just remember that think about where you're at, think about the anatomy. So thoracic aorta is more concerning than the abdominal aorta. Why? Well, in the abdominal aorta, you have the retroperitoneum around it, so it could tamponade it and potentially stop it. My understanding is some of these are treated just medically. But in the thoracic aorta, if it ruptures out into the pericardial sac, you'll get hemopericardium and probably cardiac tamponade and relatively quick death. If it ruptures out in the left pleural cavity, same thing. So that's why in the thoracic aorta, they're much more concerning than the abdominal aorta, relatively, and that's because of the potential complications. That aortic dissection, like I said, I've looked this stuff up, and basically in Robbins has the best explanation of it. It says it dissects down the annulus, disrupts the annulus, and then you get leaking. I've just described where you can rupture to, and then remember, it can also extend to the branch vessels, so you can get extension of the dissection along the carotids, which could lead to an infarct. This is probably one of the ones I showed you before, but I have many pictures of blue hearts from blood in it. And so here's the blood. You can see it looks kind of tense. That's the hemopericardium. And then the bottom right is opened up. So this is why a thoracic aortic dissection is much more concerning, because it can rupture into the heart sac and potentially cause death relatively quickly. The top left, this was actually dissection into the branch vessels. So you can see it involves the carotid artery there at the yellow arrow. So if that happens, you could potentially get, some degree of stenosis, obstruction of that, and you can get, ischemic of the brain, and potential cerebral infarcts in that. The bottom right shows dissection that went down to the aortic valve. So it never actually dissected out and ruptured into the pericardial sac, but it dissected down. And like I said, you would think, well, why doesn't that cause stenosis? It seems like it causes thickening of it. And I would agree with you. It seems like that from that. But the best I can find in going through the literature and everything like that was that it just disrupts the annulus and makes the valve leaky. So you would have a acute aortic insufficiency type murmur. Then just including there's different categories for how they do them, type A, type B. I think the important thing is, really, I think is honestly understand why, why thoracic are much more concerning just for the reasons we've talked about, because they're much more likely to have high mortality complications than the ones that might involve the, below the diaphragm or something like that. This is actually Horseshoe Lake up in the northwest corner of Montana. My aunt had a cabin. We did a lot of water skiing, not on this lake, but around it and stuff like that. So there's a little island out there. There's actually a really, really terrible horror movie made on the island. I think it's called On Heaven's Pond. If you're ever really bored, it was filmed up by where my parents live. So other aneurysms and dissections, there are other ones other than just aortic dissection. You can have a coronary artery dissection. These are most commonly associated with young women, although they can occur in other ages and everything like that. And they often occur during pregnancy. I actually saw somebody during pregnancy who had both a coronary artery dissection that they survived and then an aortic dissection that they did not survive. You can see splenic artery aneurysms. And then you can see vertebral artery laceration or dissection. And these are commonly associated with blows to the chin. So if somebody's struck on the chin, head goes back, it can tear it. It's a common, at least forensic association. But that's a good one to know. I mean, just for, common trauma associations are good also to know for people who deal with the living as well, too, because you know things they might be at risk for. So this is a coronary artery dissection. The top left is a cross-section of the coronary artery. It's hard to see, but the red circle outlines it, but you can see the blood. And then the white is the lumen. So everything around that's kind of blackish, that's the blood. That should be the lumen. So it gives you an idea. So it compressed it like that. And then the bottom right, you can see, as with the aortic dissection, it dissects in basically the outer 2/3 of the media. This black star shows the lumen of the coronary artery, and you can see the hemorrhage in the wall of the coronary artery. And then I included this. It's not an aneurysm or a dissection really, but a traumatic laceration of the thoracic aorta. Now this is a forensic one, but I have seen this in the USMLE outline. So it is important to know. So what happens is basically when somebody is traveling, if they're going at 60 miles an hour and all of a sudden they stop, for example, if they're belted or something like that and they stop, their body stops, but their heart doesn't. And so the heart goes forward, and then basically where the aorta is kind of free in that area right around where the ligamentum arteriosum is, that pulls forward and tears in that location. It is also possible for somebody to have their chest compressed and pinch the aorta and tear the aorta that way, and that would be in a different location. But this is kind of the classic mechanism, that sudden stoppage. If the body stops, the heart doesn't. And then it keeps going forward and tears at the point where it goes between tethered, which is where it runs along the aorta, and not tethered, which is where the heart is in the pericardial sac. Okay, so here's the question again. So I'll pause. Okay, so a 37-year-old male presents in the emergency room complaining of an excruciating headache. He has no other symptoms. His temperature is 97.8 degrees Fahrenheit. His pulse rate is 112 beats per minute. And his blood pressure is 156/91 millimeters mercury. Lumbar puncture reveals bloody cerebrospinal fluid. He dies and an autopsy is performed, identifying a second pathologic condition other than the one causing his symptoms. In which organ or organ system was this most likely found? So I should also include in there that it would be related to the underlying cause for his death. So what happens is he died from a Berry aneurysm. That would go along with a severe headache, blood in the cerebrospinal fluid, and then that would be kidney. So like I said, the association of autosomal dominant polycystic kidney disease and Berry aneurysm, I have seen at autopsy several times. So it's a very good association to know. Okay, given only this microscopic section, a pause. Look at it, answer it, and then we'll go. Given only this microscopic section of pathology, resident was asked by an attending of the following demographics, to which group did this individual most likely belong? So I will say this is not really a fair question, but it hits on something that's really important, association. And so the answer I'm looking for is young female. So if you look at the black, that's actually like hemorrhage and fibrin and stuff in the wall of the vessel, in the wall of the coronary artery. And so this could go along with the idea of a coronary artery dissection. And like I said, coronary dissections occur in a wide range of individuals. However, they are most commonly associated with, and a good one to know, is with pregnant females. Okay, and like I said, sorry I didn't include the question in the last one, but I put in here the one with the autosomal dominant polycystic kinesis. And remember, my questions are designed to make you think about the material and apply the material, not necessarily that they would survive the 4+ committees to make it on the USMLE for grading. Okay, so use reflection and think about, hopefully 5 things you learned during the lecture. This is a really good way to help cement the material. And like I said, I'm not going to give you a summary because that would defeat the purpose, because you go straight to that. And like I said, it's shown to be really useful in helping students improve their scores in that. So for the end of it, I'm just going to put this: which of the lower 48 states has the lowest recorded temperature? That would be, of course, Montana. So it was recorded at 80 below. It was in Rogers Pass. 70 below in Rogers Pass. And then here's Rogers Pass, which if you've never been a mountain pass in winter, it can be a real fun experience, I will say. So I hope this lecture has been useful for you and help you understand aneurysms. And like I said, if you have any comments or suggestions for improvement or anything like that, I'd be more than happy to see them and like that. I really would like to make a good online resource. I'm finally dedicated to doing this, and I want to make something available to students that they can easily access and will help them. And I can use your feedback to do that, and I appreciate it. Thank you very much.